Hey, this is Dr. Joanna with Momenta Chiropractic, and today I'm going to be talking about nerve glides and tensioners. Nerve glides and tensioners are a type of nerve mobilization, which means that we're basically moving the nerve along the pathway as it's traveling down your arms or legs. So these are great mobilizations to use for people who are experiencing any radiating type symptoms down their arms and legs. That can feel like pain, numbness, tingling, burning, tightness, just any sort of radiating symptom that's coming from the neck or the lower back. Now I'm going to demonstrate what nerve glides and what tensioners look like. So in order to do that, I'm going to use this TheraBand as my visual for you. So I'm going to put this around my back and over my finger to mimic the median nerve, which is one of the major nerves that runs from your brachial plexus in your neck down your arm. And this nerve supplies the muscles and sensation of your arms, which can trigger some of those radiating symptoms. So in order to perform a glide, I'm essentially going to be extending my wrist and then flexing my head toward my hand so that I'm pulling tension on one side of the nerve and I have slack on the other side. So I'm going this way. And then to do the opposite, I'm going to pull tension on the nerve from my neck and allow my hand to relax, so I'm getting tension on one side at a time. And we're basically allowing the nerve to slide back and forth along the pathway, and kind of in this like flossing or gliding motion. Now, in order to do a tensioner, we're going to do the opposite, where we are pulling tension at both ends. So I extend my arm back and flex my head the opposite direction, and you'll see there's no slack within this nerve at all. We're fully tensioning this. So we use these as a form of symptom relief, particularly with the glides where we're flossing the nerve back and forth. That can be really relieving when you are experiencing different types of radiating symptoms. And while that inflammation is coming down and the nerve has began its healing process, we'll slowly introduce the tensioners in a very mild way to rebuild the tolerance of that nerve and reintroduce that tensioning force so it's not as aggravating. These exercises can be very helpful in relieving radiating symptoms. However, it is very important that you get a proper exam done by a professional that can help you identify the cause of these symptoms and which nerve is involved, so that you're prescribed the appropriate exercise. I hope this was a helpful introduction into nerve glides and tensioners, and please feel free to reach out if you have any questions.